Hello LovelyyOT, teacher girl Nancy. I am back again with another video. This video I am going to be talking about one of the frequently asked questions, and that is, what should I major in if I want to be an OT? So I'm just gonna go down my list. I have some notes on my laptop, so I'm just gonna go over like what my personal advice is about that, or my personal answer to that question is. So do you need to have, and one of the questions that I also get a lot is that, do you need to have a science background in order to be an OT? And the answer is no. Why not? Well, I'm an occupational therapist, and my undergrad degree was in psychology and a minor in gerontology. That's the kind of background that I'm coming from. Did I take science courses, which is a prereq in order for me to get into OT school? Yes, I did take functional anatomy 1 and 2 in order to get into OT school, but my main major was not in the science degree. So just to get that out there. I don't think that you necessarily have to have a science background in order to be successful in the OT field. I think the most important things for you to have in order to be successful is that you definitely have to love rehab. You have to love the concept around rehab and rehabilitation. You have to be creative, but I don't see myself as a super creative person, but sometimes I do come up with something and I'm like, oh, that was pretty creative, but would I identify myself as someone who is creative? I don't think so, honestly. I think there's a lot more creative people out there, so being creative is definitely gonna help. Also, you have to also be someone who think outside the box, okay? Be an outside the box thinker. It's really good to come up with stuff that people have not thought about, or have different ideas, bring different ideas to the table and stuff like that. If you can use the things around you to help your patient, that's also a really good quality to have as an OT. That also kind of goes hand in hand with the whole creative thing. Being a creative thinker, using things around you, being a problem solver is definitely one of the qualities that you need. Also, but I am gonna talk about like different majors that I think will be beneficial if you are thinking about, okay, you're really stuck and you're really thinking about what to major in. I would definitely say any science course, major in biology, or maybe take a class in anatomy, or maybe something with neuro, because and I'm basing all of this stuff on classes that we took in OT school. So neuro, I love neuro, right? The study of the brain, the spinal cord, and all of that stuff. I think it's so amazing. And if you can get a degree in neuroanatomy, neuro something, I don't know what kind of degrees they have out there. They have like so many different degrees out there now that I'm not even sure what's a degree and what's like a class. So if they have a degree in neuro, then you can do that, or if you can take a class on neuro, then do that as well. I know for me, that was my second option. If I wasn't gonna go into a T, I wanted to go to neuro and be like a neurologist or a neuroscientist or something like that. So neuro is definitely something that it will be beneficial if you had some experience in that. I will also say psychology is also beneficial, or any kind of class or degree in psychology, mental health, anything about that is also important as well, because a big part of your job as an OT is definitely gonna have to be you having a really good psyche, so to speak. You're gonna have to be a relatable person, someone who can kind of have empathy for people and sympathy for people. You are also someone who's very in tune to people's behavior and how they're behaving based on different things that's going on. I think it's really important to have that degree. For me, I think having a psychology degree has definitely helped me a lot. I can literally put myself in a lot of people's shoes and kind of feel what they feel, and I am able to relate to people. I am able to help people in that way, in the psychology aspect, more than the science aspect. because you can always look up scientific or science type of questions, like medication type of questions. You can look it up. You can look up diagnosis. But psychology is something that you kind of have to, be a part of you, so to speak. So nobody can really teach you how to have sympathy for people or to empathize with people. You kind of have it or you don't. That's another course that I think will be very beneficial is definitely kinesiology. So like studying the biomechanics of the body, that was a really important class in OT school. When I took kines in OT school, I did not like it at all because I was not used to thinking in that aspect of looking at the biomechanics and like how the different, the hinges and all of that stuff. I was like, what are you talking about? I was so lost in that class, and that was actually one of my hardest class. I hated kines so bad. It's such an important class because once you start practicing, you're going to understand why you need to understand kinesiology and why it's all important, like the angles and hinges of the body and the joints and all of those things are so important for you to understand how the body works. I think exercise science is another really good degree to have because I think a lot of the things that we do, it's absolutely combining science and exercise together. So what we do has a lot to do with exercise. So if you can get a degree in exercise science, if you can take a class in exercise science, then I would say absolutely do it. Also, with the whole thing about the reason why it's so important for you to take anatomy, for example, in order to be an OT, I know a lot of people, sometimes my patients ask me like, why did you have to take science courses in order to do what you're doing? And they don't understand that in order for me to treat you properly, I need to understand the body, the human body, and how it operates and how it works. For me, taking something like neuro, for example, has definitely helped me to understand why stroke happens and why you can lose your motor functions versus your sensory, and why you can lose both, and all of those things makes a lot more sense to me because I took the anatomy part of it. I understand where the science part is coming from, and that makes it a lot easier for me to treat my patients effectively. I think that it's important for those classes to be taken because if you don't take those classes, you can come up with exercise programs for your patients, but are you really understanding how the body works and why you need to do this exercise versus that exercise? Your muscles work together and how every part of your body is important for you to work. The fact that you have to know, the parts, your hip and all of that stuff. For example, one of my patients, I treat a lot of patients with total hip replacements and hip fractures and this fracture and that fracture. And most of the time when I am explaining things to them, like, okay, you are not supposed to bend over 90 degrees, I understand what I'm saying and I can teach them more effectively because I get it. You know what I mean? I get the biomechanics of it. I understand the fact that if I internally rotate my feet, then my hip is going to externally rotate. I understand that concept, and for me to be able to understand that is very important because then I can explain that to my patient. I can show them, of course, but it's important for me to understand it biomechanically and also how the bones move on each other and all of that stuff so that it can make sense to me and also be able to explain to my patient well enough. It allows you to be a more effective therapist, so you can explain what you're doing with your patients, and not only that, it also allows you to understand what it is that you're doing with the patient. So it's definitely important to take those anatomy and those science courses. I'm telling you, it's super helpful. Are you studying them because you are the doctor? Absolutely not. However, it allows you to understand what you're doing in the treatments that you are giving the patients. That's how I see it. So apart from these classes that I mentioned, any degree will work. Education, I don't know, English majors, whatever major that you have will work in OT because I feel like that's what makes OT such a diverse career, because there are people coming into OT with different degrees, and I think that's what makes it so unique because each person have a different way of looking at things, and together, collectively, it makes it, even better. So if you had an OT that was working with you from a science perspective, then your treatment might be a little different from someone who's coming from a psychology background versus educational background or whatever, but we are all in the same class and we are all getting the same education. However, you can see the different dynamics, especially when you're in class, and how people are thinking and how people see things is definitely different. Some classes are a lot harder for you depending on which major you had. So like for me, for example, for some reason I've always loved science. So I remember when I was in high school, I loved biology. I've always loved biology and psychology. Those are my two favorite things in the world. But the classes that I struggled a lot with was kinesiology. I just could not wrap my head around that thing. Eventually it came to me, but it definitely took a lot for me to. It was kind of like I've never taken a class in kines before. That was my first time ever when I started OT school. So I had to literally learn everything, like everything. So yeah, apart from those degrees, literally any kind of degree will work for OT. Like you don't have to have a specific degree. However, having a science degree, having an exercise science, rehab, and all of those type of relatable degrees would definitely help, but it's not mandatory, if that makes sense. As long as you have taken all the prereqs that you need in order to get into OT school, that's it. That's all you need. So yeah, that was the end of my video. Thank you guys so much for watching, and I'll see you next time.